Latinos, Latinas, this is Jose David Cantu once again from Hispanic News Online. I keep promising you I'm going to introduce you to a new Latino or Latina or organization that is helping our community. And I'm not breaking my promise to you. I'm bringing you 30 for 30 days. Some of these people don't have a lot of PR, behind them, but I've researched them and found them throughout the country, and they're doing really, really good things for the community. So I'm hoping that you guys not only get to listen, but also take advantage and reach out to some of these folks and get connected with them because uh, if they connected with me, I'm pretty sure they'll connect with you. And this morning, I have somebody really special. Andres Gonzalez came to me via another friend who said, "You've got to get this guy on here. He is incredible. He's doing some incredible stuff." And I'm going to tell you, Latinos, Latinas out there, that I didn't even know there was any Latinos in Milwaukee. But this guy is from Milwaukee. Andres, come and tell us a little bit about yourself, man.
Absolutely. Well, first of all, Jose, mil gracias for the invitation, for the connection here. I'm always humbled and flattered by the opportunity to share a little bit about my story and my journey here. So it's wonderful to be connected this morning here with you. So as everyone already has heard from Jose, my name is Andres Gonzalez, and I'm the new Vice President and Chief Diversity Officer here at Froedtert and the Medical College of Wisconsin, and we reside within the greater Milwaukee area. So that's where I live, or have lived for the last 2 months or so. And but I'm originally from Puerto Rico, actually born in Trujillo Alto, Puerto Rico, but raised in Carolina, Puerto Rico, and obviously claim to fame there is the connection to Roberto Clemente. And I ended up actually playing on the baseball fields that he built for our community. Hence, I play with number 21 most of my baseball career all the way up to college. So that's my claim to fame to about Puerto Rico. But at the age of 13, my parents actually decided to uproot the family based on the economic climate in Puerto Rico and took us to Cleveland, Ohio, of all places. So Cleveland became our hometown and our state, obviously Ohio, where we resided until 3 years ago, where then we took the plunge to go to the East Coast for another opportunity that I had with another healthcare system, and then now being here. So happy to be here this morning and to share some of my journey and insights here. So thank you for having me.
You know, um, you're gonna have some great information for us. I know because we've already spoken a little bit about the what we're gonna talk about. And Andres, make sure that you talk a little louder to the mic because I don't want anybody to miss out any information of what you're about to tell them. So I from what I when we talked about this earlier, we were talking about the field that you're working in. So can you give us a little bit more information about the field that you're working in and how that affects the Latinos in your community?
Absolutely. So let me actually start by providing you a little bit about the organization that I work for, my employer, and then I'll tell you a little bit about my primary role here. Is that okay?
Yeah, that's great.
Jose? All right, so let me actually just so everyone who might not be from the region here, so they get a good understanding of who we are as an employer, as a workplace of choice, quite frankly. So Froedtert and the Medical College of Wisconsin is an integrated healthcare system that is composed of Froedtert Memorial Lutheran Hospital, which is an academic medical center. So that means that we actually have an affiliation with a teaching hospital or university. In this case, we have it with the Medical College of Wisconsin, the medical school. And that's a level one trauma center. So everyone who has high acuity or experiences any trauma is taken to that hospital here in the region. But then, more importantly, we are an integrated healthcare system. So we have two other hospitals in the region, one in the western region here in the Milwaukee area called Community Memorial Hospital, and the other one is St. Joseph's Hospital in the West Bend area. So we actually cover a good portion of the southeastern area of the state. And then we have about 25 health centers in the region where people actually can go and access care locally, which is actually part of our promise to our community here. And furthermore, we actually also own our health plan. So we definitely are fully integrated from that perspective. So we can obviously give you access to our health plans, or you can have access to our wonderful care through any of our primary or specialty clinics that we have here in the region. In my capacity as the Vice President and Chief Diversity Officer, what I do is actually we have created a strategic support or imperative to help the mission. So our mission is really to deliver the best patient experience to our community. And so, clearly, looking at the change in demographics, we have a very diverse community. To your point earlier, Jose, we have a large Latino community, actually, large Mexican American and Puerto Rican community that are probably fourth and fifth generation by now here in southeastern Wisconsin, obviously in the greater Milwaukee area, that call Milwaukee their home. And so for us, it's really an imperative to be able to provide culturally and linguistically competent care to everyone that crosses our doors. And so that's actually one of the departments that actually I support and I oversee. So we have, interpretation and translation services here. We call it language services department. That actually is under my purview. But I also partner strategically with HR, with human resources around obviously attracting and hiring and retaining and developing a diverse workforce. And for us, again, that's actually one of our commitments that we want to reflect the communities that we serve because we understand how critical it is to provide both culturally and linguistically that care to our community and keep it local. So we have a workplace strategy, as I mentioned, where we partner with HR. We also clearly have a workplace pillar or strategy as well, which is actually providing training to every single staff member. And for us here, the way that I approach it is everyone is a caregiver, whether you provide care at the bedside as a nurse or physician, or whether you're on the administrative side supporting those clinicians, everyone is a caregiver. And so for us, it's really imperative to make sure that everyone has the understanding, the education, and the tools and resources to be able to be equipped, right, to be able to provide that care, that patient experience. So that's also part of our strategy. And the last piece is marketplace, looking at how do we connect with community. And the way that we do that is really around our partnerships and also co-leading those efforts with our community engagement department around creating or strengthening partnerships that will allow a lot of our nonprofits, in this particular case, our Latino serving not for profits, to be able to promise, to deliver on their promise in terms of their mission. And so we have a number of organizations that we partner with who are making honestly a great impact in our Latino community here in southeastern Wisconsin. And so we have decided to make sure that we partner with them so we can create greater community and economic vitality in the greater Milwaukee area.
Well, one of the reasons I wanted to talk to you about, I wanted you to come on board was because I wanted to be able to not only show what you guys are doing in Milwaukee, but also to give a bigger perspective of how much need there is for Latinos and Hispanics to be in the medical field. And we're not only talking about you know doctors and nurses, because I mean, come on, there's nothing like having being in the and sick as as can be, and being in the hospital, and you reach over or talk to somebody and you can talk to them in Spanish, and that just makes you feel so good. And and we definitely see that in nursing and in doctors, and we hope that more of our kids go and get medical training. But there's also other avenues, and that's why I wanted to talk to you, because you bring to the table the other aspect of the hospital. It's the administration part, and that there's a lot of opportunities out there. Is that correct?
Absolutely, Jose. To your point, we have over 2,500 professions within healthcare. Someone can actually decide that, what, I might not be a clinical person. I'm not really gravitating towards being at the bedside because they might not be able to actually stand the smell or the, obviously of blood, for example. But you know what? They can make their contribution by being an administrator. They can make their contributions by actually building our facilities or upkeeping our facilities. So there's over 20, whether it's actually cooking for our patients, being part of our, obviously, our hospitality staff there. So we have over 2,500 opportunities where individuals, and especially Latinos and Latinas, can really look at and really make a great contribution to us as a healthcare facility, but more importantly to the patients that we serve. So I think healthcare is a great sector, and clearly, it's one of those sectors that while we continue to be, I think, impacted by technology, you will always still have to have humans providing and touching our patients. And I think that there's no other, I think, great sector where someone can gravitate to and devote their lives and commitment to really helping someone to get better or to be healed and to be able then to go home and enjoy their families and have great quality of life. And I think that that's the magic that happens in healthcare, and why so many of us, and like in my case, I gravitated towards healthcare because I knew that there's no better mission than serving others, especially when they're sick, and especially when you can provide that touch and that care that will heal them and will get them in their journey to have a quality of life and enjoy their families and friends and their community at a much greater level. So I think that that's actually a great opportunity, and healthcare is a booming sector. And it's about 20% of the GDP nationally. Obviously, we're all trying to contain our health expenses, I think, as a nation, and it's the right thing to do. But again, healthcare is going to be here and will stay forever because it's a service that it's needed within our community.
And as a Latino, do you find, I mean, that what you're doing is has opened doors for you as a Latino? I mean, is would you say that even the speaking Spanish and knowing the culture that has helped you in your career?
Absolutely. I think that part of it was actually to be educationally prepared for the opportunity. The other piece that no one can take away, which I think it's priceless, is that whole experiential opportunity that we all have as Latinos, where you're a bilingual, bicultural individual. You can navigate two different cultures. You can speak multiple languages, and you can be that bridge, right? That bridge builder for our Latino community and the mainstream community in particular roles. And I think that all the roles that I delineated earlier are all impactful in that way, where you can actually be an instrument, a vessel to help people in our community, especially those who are limited English proficient, who might not have a lot of experience with, healthcare as we know it here in the U.S. And it's extremely daunting to ask them to come into a large facility and navigate those facilities. And I honestly take great pride in the work that we do because we help to actually provide greater signage in multiple languages so then our limited English proficient patients, whether Latino or otherwise, can really navigate our facilities far better and be able to access the level of care in the right departments. And so for us, that's actually part of the pride of and joy that we obviously experience and rewards that we have in our field. But I also think it's also about meeting the needs of our community and meeting the community where they're at, Jose. And I will tell you, it's still disheartening in 2015 when I look at our communities. And I lived in Cleveland, which is actually part of the Midwest, as it is here in Milwaukee, but also on the East Coast. And you would think that it's actually greener on the other side of the fence, quite frankly, until you get there and you experience that, what? We have still issues around low educational attainment that are preventing our youth to obviously excel and to be able to actually have great opportunities in life. But then also when you look at the healthcare in our community and you see all the disparities that still exist around cardiovascular issues, diabetes, for example, obesity, these are all issues that are preventable. And these are all issues that we can actually get our arms around it if we were far more educated and had the knowledge to really wrestle with these issues strategically. And I think that that's the other piece that really inspires me in my role to be a far better leader and really to, I think, influence the type of initiatives and strategies that we're creating for our community and meeting them where they're at. And so I take a lot of pride and joy in my team in terms of influencing and educating our other executives around the type of initiatives and education and resources that are needed to meet the needs of our community. And so I think in 2015, if you would ask me to rate our sector, if you will, or our efforts, I would say, we're probably, no better than probably a C or average, quite frankly, in terms of our efforts. But the beauty of it is, and what's inspiring is, we're moving the right direction and we're making a much larger investment in the community to address those needs moving forward.
Well, that's really good to know because you know what? I used to live in the East Coast, and I'm not going to mention the hospital or anything, but my wife had a surgery, and I actually walked into the hospital, and I ended up having to help so many Latinos who were there for the very first time and who had no way of understanding, where they were supposed to go or what they were supposed to do after they left the certain doctor and go down and get X-rays or whatever, and that I had to communicate to them in Spanish how to get to the place that they had to go because they didn't have enough information and you could see it in their eyes. They were confused. It's this huge building with lots of passageways, a lot of sterile stuff and stuff that scared them, and they just came in because they were sick and they're not the best. And so I'm glad that you guys are working on that. But let's get back to your education. Give us a little bit of background on how you got involved in the management sector of hospitals and what it took you to get there.
Sure. So I will tell you that I think my journey it's been an interesting one. I mean, it was not something that I necessarily forecasted and decided to actually pursue early on as a teenager when we transitioned here to the States. But I think that first experience that I had moving from Puerto Rico, where I was actually that was actually that's home, right? That was actually where I was born, where I was raised until the age of 13. And so I had a very different outlook in life until we arrived here in the States. And then I found myself, I don't speak the language well. I do not know how to engage in this new culture. And so going through that own process as a teenager was very difficult. So not only acculturating because we had to now in a new country, right, and the new expectations of our community, but also as a teenager, which was really difficult for me in terms of my own identity and background. And so I think that was probably, as I have looked back and I have really being introspective about what really motivated me to get into this field, I always go back to that first experience coming here, in the mid 80s to the US. And so that provided me and taught me a lot of great lessons about why it was important to acculturate, but more importantly, to retain my own culture, my own language, my own heritage, and be that bridge builder, that cultural broker, if you will, that has served me well. And I think that that's what really inspired me to get into this field. But early on, actually, as any teenager, I went to inner city high school in Cleveland, Ohio, pursued my education, and then decided, what, I want to actually become a pediatrician. So my background is actually my undergrad in biology in pre-med, and then in my third year of college ended up actually falling in love with not-for-profit work, and I needed a job, quite frankly, as well. So it actually met both needs, and it really inspired me to make a difference in my own community. And the fact that I was able to engage with my own community in my own language and get paid for it was actually, I think, the win-win-win all around it. And so that really started shaping my understanding and direction for the work that I wanted to do ultimately as a professional. So I started actually providing life skills prevention through a not-for-profit in the Cleveland area called Hispanic, and I stayed with them for about 10 years, ended up actually moving up the ranks until I actually managed and ran the organization. So I was the executive director of the organization. And then from there, I went to another Latino serving organization that provided workforce development. And it was actually at that organization that I actually learned about the opportunities with, the public and private sector opportunities or partnerships. And so I struck gold with Metro Health Medical Center, which was the county hospital in Cleveland, but also with the Cleveland Clinic at the time, in terms of creating a pathway for our Latinas who wanted to actually get into healthcare, but didn't have the ability to actually go back to school necessarily because they had kids and they had a life and they needed to actually get something that was meaningful and that would provide livable wages and benefits. And so we created a pathway in partnership with the healthcare systems there around a what we call a certified nursing assistance program in the state of Ohio there. And it was the only bilingual bicultural certified program in the state. And I saw the difference that it made for not only our young women who were going through the program, who were in government assistance, but more importantly, the impact that it made in those healthcare settings to have now a bilingual bicultural clinician who can really provide culturally linguistically competent care to our community. And so I saw the transformation there, not only for that young woman, but also for the patients that they were caring for. And for those patients to say, she gets me, she understands me, I know that I'm actually in trusted hands, in good hands here. And so that really led me then to really focus much more in healthcare. And it was actually Cleveland Clinic who invited me to join their ranks to really build a diversity and inclusion program there. And so I stayed there for close to 10 years. And then 3 years ago, I actually went to the East Coast. And so I think when you look at my career, my journey, it has been a little bit of, being in the right place at the right time, but also about being prepared for those opportunities and always keeping in mind what's first. And for me, it has always been about my community and those patients that we serve in the healthcare setting. And so that's what I keep in mind every morning when I actually am driving into my office or into one of our facilities to talk about any type of initiative. It's ultimately how do we impact and provide greater care, culturally and linguistically care for our diverse patients here. And so I take a lot of pride and joy in what I do. And so that has really formulated not only my journey professionally, but also in terms of my education. So I have gone back and have gotten, a master's early on actually in agency counseling because that was the type of work that I was doing, but with a minor in cultural competence because I understood that I needed to be a better cultural broker and advocate for our Latino community and those who were English, limited English proficient. So that really has been part of my journey and my commitment to my communities.
Very interesting. Very interesting. I started this conversation earlier with, kind of poking a little bit of fun about, I didn't know there was that many Latinos and Hispanics in Milwaukee, Wisconsin. But as I'm talking to people throughout the country, I'm really finding out that there's great amount of pockets in Idaho and Wisconsin and Washington State of Latinos. And so I would, I'm not going to assume, but I'm just going to ask you, would you say that there's probably a need throughout the country for Latinos and Latinas to get involved in the medical field because of this type of diversity and how we're just actually spreading throughout the country, and that there is, I mean, some areas, I mean, that there is no organizations and no things, nothing set up to be able to help, but if they get involved, they can
Right.
make a difference. Is that true?
Absolutely. Well, I will tell you, Jose, in general, in the healthcare sector, as in many other sectors or industries, we already have shortages of nurses nationally. We have already, and we're forecasting shortages of physicians nationally. And so I think when you look at the need, especially in our healthcare sector, we already have the shortages today, let alone as we continue in the next few years and we have massive exodus of our baby boomers because of the economy obviously improving in many areas in the nation. Many of them are deciding to retire finally. And so we're going to have an opportunity here. So the question is, how do we change the challenge that we have or void into an opportunity? And this is, I think, to your question and to your point, it's a great opportunity now for Latinas and Latinos, whether you're a teenager, whether you're a young adult, or whether you're actually someone who's actually looking at starting my second career. This is actually a great sector to look at. And for anyone who's interested in helping our community and really closing some of those disparity or gaps that exist, this will be a great sector for anyone to look into and to really focus on. And I will tell you, the healthcare sector pays fairly well. I mean, you can be a nurse and make a great salary a year where you will be able to sustain yourself and family if you decide to, if you choose to go in that route, whether, a nurse, whether a physician, whether actually on the administrative side. I think the healthcare sector is a great sector for anyone who's really interested in making a difference in their community, and it pays well. So I think it's really what a lot of our young adults now and teenagers are looking for. What is something that will be meaningful for me, where I can make a greater contribution? I would say it is within the healthcare sector. You will find those opportunities where it will fulfill you personally and professionally, and ultimately you're making a big difference in our community. So I think there's going to be great opportunities for our Latinos and Latinas, irrespective of their age group or generation, quite frankly, whether you're a baby boomer, Generation X, or millennial, or Generation Z, which is the new one now coming into the workforce, to look at the sector seriously as a pathway that will give them the quality of life and the meaningful opportunities that they're looking for.
And question I had for you earlier, and it almost slipped my mind, was um, when you started this, when you started on this path, you mentioned that you started kind of in a medical. Did was your background, I mean, your family life, was that sort of what kind of drove you to the medical field? I mean, because I know that in my family, I have a brother who is in the medical field, and it was like my tias and their kindness and their sweetness, I think, and their bedside manner that actually really helped him in his career. Is that something that has helped you?
Absolutely. I would say that, my parents have been probably my greatest role models and mentors along the way, even though I have, great mentors and, professionally that have really shaped my thinking and my career aspirations over time. But I will tell you, it really started, I think, when we moved here, again, going back to that experience, having to actually go and interpret for my parents, right? And help them and guiding them through the process on how to navigate in a new country was really powerful. And it was actually really interesting to see how a lot of that power shifted from my parents to us, because we're actually learning the language and we're becoming far more proficient than they were in terms of adjusting to the new culture, the new expectations. And I think it was those experiences that really shaped a lot of my thinking and outlook in life, so much so that I knew that I wanted to work over time in the healthcare sector. Um, but it also actually shaped my brother's life, actually, my younger brother, who's actually the physician in the family. And so he's a primary physician. He's actually an internist by training, and he's doing very well in Florida. But again, for us, it was about understanding how we can be a resource or that vessel to help our community. And that was something that my mother really instilled in us early on. Never forget where you came from, and always make sure that you give back to your community. And I always like to use, obviously, and make reference to something that I live by, which is biblical. And it is actually, to whom much is given, much is requested or expected. And I live by that because I think, we've had great opportunities, but we cannot forget where we came from. And so the question for me and for us is, how do we actually bring others forward with us? And I'm a big believer of mentoring and really helping the next generation to get and really achieve their aspirational goals. And so I think that when I look back at my own journey, I think that it really started there in the conversations that we would have at the dinner table with my parents around, getting that education. It was not about, do you think you're going to go to college, but it was around more around there. That's the expectation. You're going to go to college. The question was, what is it that you're going to be actually majoring in, and how many degrees are you going to get? And I'm glad that those were the type of conversations we had at home. So there was, they raised the bar for us, and they gave us a greater outlook in life, and they told us you can achieve whatever you want as long as you actually put the time, the effort, and the commitment into it. And so I think my parents are proud of the three professionals that they have been able to actually raise and shaped.
Wow, I bet they are. I bet your family's very proud of you guys. We should be very proud of you as a community also, because I mean, you are a highlight of what we should be and what we should strive for. Let me ask you this real quick, because
Yeah.
I know that we're doing this in order to make sure that people reach out. Uh,
Yeah.
I want you to plug yourself. Give me how people can get a hold of you if they want to either start a program or work with something, maybe a program that you guys are doing, or even plug your a program that's working with the Latino community at the moment that
Sure.
you're proud of. Can you get me some information of how people can get a hold of you and maybe ask you some questions, and maybe it'll help them and their community?
Sure, Jose, that's a great question. And again, to my point around mentoring and being a resource for anyone who's out there who would like to learn more about what is it that a chief diversity officer does, especially in the healthcare setting, or they might actually want some advice or learn much more about some particulars, I would be delighted to do that. So there's two ways in which people can reach me. One of them is via my professional email account, which is andres.gonzalez at Froedtert.com. So it's ANDRES period Gonzalez, GONZALEZ at Froedtert. And so let me spell Froedtert is FROEDTERT.com. So that's one way in which people can get a hold of me. And I will tell you, I'm connected 24/7 to my work email, and or they can actually call my landline here, which is area code 414 777 3582. Again, 414 777 3582. Either way, I tend to respond fairly quickly to emails and phone calls. So if anyone is interested in learning more, or they would like to actually just get some advice, or they would like to get a little more insight about healthcare, the sector, or my role, or the work that I do professionally and civically through my involvement with not-for-profits, I would be delighted to provide that information and advice.
Oh, Andres, that's wonderful, guys. Latinos, Latinas out there, please, take advantage of this. Uh, I hear from professionals all the time. We give out cards, we tell people to call us, and they don't reach out. Mira, esta gente, they are sitting down with me. They're talking to me. They're giving you information. They're opening their lines, their phone call, the phone numbers. They're giving you their emails. Please reach out to them. They don't want comadres and compadres, but if you have some serious questions, they will answer it. And if you have a child who's about to go to college or is thinking about getting in the medical field, why not ask an expert? Andres will answer your questions, and he will help you along the way. Please reach out. Don't be shy. Don't be scared. Por favor, por favor. If you si no hablan, si no preguntan, you won't get your answers. Pero aquí estamos dándoles la información que puedan usar, and so please take advantage of it and reach out to these guys. Andres, I want to thank you very much for coming on board. I'm going to give you a few more minutes to just say something as a farewell to everyone. But I don't want to take up too much time because I know you're busy. So the
Thank you, Jose. First of all, thank you again for thinking of me and highlighting my story, my journey here. Again, as I mentioned earlier, I'm always humbled by the opportunity. But I want to leave folks with a couple of thoughts. Number one is, especially for those young adults or individuals who are searching right now, what is it that I want to do in life, or how can I actually aspire to get to that desired level? I would say that had I not been very focused and had done my goal setting exercise, and I was very focused on knowing where I wanted to go over time, and honestly getting the advice of folks. So to your point, I was one of those young men that took advantage when people actually said, "Here's my business card." I always actually would prompt people and say, "You know what? Can I actually call you and set up a conversation, over coffee or over lunch?" And I made it a point for me to actually get advice from the wisdom that all these individuals had, especially the Latinos and Latinas in my community when I was actually growing up. And had I not done that, I'm not sure that I would be where I'm at today, Jose. So I want to actually urge everyone that, take advantage of this 30 leaders that Jose is interviewing. Take advantage of the opportunity to have access to them. Ask them the questions. Ask them, how can I connect? What is some advice? What would be your recommendation around whatever the particulars are? Because I think that that's what will help you and will redirect you or direct you in the right, I think, obviously, heading you in the right direction here. So that's one point. The other one is, be proud of whom you are and leverage your skill sets. And I will tell you, someone early on in my career, and actually it was my mentor, Jose Feliciano, who was a seasoned and very well I think, regarded individual in the Latino community there in Cleveland who said, you know what, you can be bilingual, you can be bicultural, and you can be a leader. And I never thought about that until he actually put it into perspective. And now, almost 30 years later, I look at myself and say, wow, I can navigate different worlds, different cultures, speak different languages, and serve as that broker, as that bridge builder for the community, and really leverage my skill sets and my knowledge and my expertise and my experiences for the betterment of my community and also to adding greater value to my employer here, to my healthcare. So be mindful of that and do not feel ashamed of whom you are and what you bring to the table. Be proud of that and leverage that because that will be your ticket to be successful in life. So with that, I would like to close. And again, if anyone would be interested in learning more about what I do and or would like to connect, feel free to reach out to me. I would be more than delighted to provide any information, advice, or recommendation that you might be in need of.
Andres, thank you very much. Everyone, that's the show for today. Pero do me a favor. It only takes you 30 minutes. Get to learn about somebody else in the community, another Latino or Hispanic that is doing something wonderful for the community tomorrow. I'm going to bring you somebody different, somebody new, somebody you probably never even heard of, but they're doing really good stuff in their community and they want to help. That's why they're here for 30 for 30 this month. So stay tuned mañana and we will bring you somebody new. This is Jose David Cantu, also known as Joe David Cantu from Hispanic News Online. Thank you for sharing your 30 minutes with us and come back tomorrow.